A very good evening to one and all present, and welcome back to the NEET preparation series by Speed Institute. So today we are going to see about drug resistance, which is the basic science subject in pharmacology. So I will not be directly just dealing with the drug resistance alone. I will be in particular dealing with the antibiotic resistance because that is one of the most important topic and a very big global threat for everyone. So today's class is going to be just brief about how this antibacterial, it's going to be very specific on antibacterial resistance and what are all the mechanism in which it happens and how can you easily remember it, and few MCQs at the end of the session for us to understand whether we have got the concept well. So with that, I'll just share my screen. Yes, I think my screen is visible to everyone. So like I said, it's going to be on drug resistance. So all of us know that this antibacterial resistance or the antimicrobial resistance is something which has been given more importance by WHO and other national global level institution organization, because where the main concept of a drug is to eliminate or to decrease the disease in a person. So if a particular drug is actually getting resistant to a particular organism, then it means to say that it is of concern because the treatment protocol gets to be changed and the way in which the disease is going to propagate is also needs to be monitored. So when I mean drug resistance, it doesn't mean that the human being is actually resistant to that drug. But the point is the bacteria or the pathogen or the microbe which is involved in that particular drug is becoming resistant. So remember, it is not the human who is getting resistant. The microbe which is supposed to act, or the drug which is supposed to act on the microbe, is getting resistant to it. That's why you get this concept of drug resistance or antimicrobial resistance. So whenever I give a drug, this is what happens. So there is an exposure to a bacteria which leads to an infection which is being treated using a drug. So there is, in the non-resistance, in the normal phenomenal day, you will have the bacteria here and it will be multiplying, causing you certain clinical symptoms, which when you give the drug, the drug is going to act on this bacteria and it's going to kill them and the person is going to come back to his normal physiology. But when this bacteria is resistant to that particular drug, what actually happens, as you can see over here, the difference is there is something called, there is a circle inside this bacteria which we can consider as a nucleus. Whereas over here, there is an alteration in that circle which makes it resistant. So when I had a particular treatment or a particular drug, the bacteria, irrespective of how the drug is going to act, multiplies, where it is not getting killed or the bacteria does not die. So this is where the problem arises, where we have to look for other solutions or different kinds of treatment for us to make the person healthy. So for a better understanding of how this mechanism actually happens is, you need to understand this similar, very, very easy concept of how this actually goes on. So, yes. So we have something called, this is nothing but your cell membrane, your cytoplasm, your outer and inner cell membranes, and this is the region in which your molecule or the cells which is the target for the bacteria is being present. So in a normal physiological condition, what happens? There is something called as porin. Porin is nothing but a protein channel. Remember it very simple. So it's a protein channel which allows any kind of molecule from outside to enter into my cell or cytoplasm. So what actually happens over here is, as it comes inside, it goes and attaches itself to the drug target, which further leads to the alteration of the cell. As a result, it kills the bacteria. But whereas in the resistant bacteria, what happens is, as you can see, that either the influx of this drug is not allowed because there could be a change in the mechanism or the morphology of this porin, which has results in not allowing the drug to enter, or even if it is going to enter the bacteria is altering its cell wall in such way that the drug cannot go and attach itself. Okay, so what happens? So this is two mechanisms. The first one, either the target area, the target site of the drug is altered, or the target site of the bacteria is altered. So this can be two ways in which the resistance happens. Or what can happen? The bacteria goes and attaches itself to here. So the bacteria goes and attaches itself, but the enzyme which needs to stop this propagation is getting altered, or the drug which goes inside the bacteria is getting degraded by the bacteria itself, because the bacteria is getting evolved in such a way that it is able to destroy the drug which comes inside it. As a result, there is a resistance developed, and there is no inhibition, or there is no destruction of the bacteria. So it can happen either for the mechanisms, the different ways for us to easily understand. The first thing is the cell wall gets altered, so the drug doesn't go and attach itself, cannot go and attach itself, or the bacteria alters its shape, or the target site is getting altered, so the drug is not able to get attached. But in case it gets attached and goes inside the bacteria, there is an enzyme which destroys the drug. As a result, there is no destruction of bacteria. So these are all the different mechanisms or theories which is being proposed by which the bacteria develops a resistance. And this is a simple schematic representation of whatever I have told you. So there can be an alteration in the binding target, or degradation of the antibiotic by enzyme, or there is an increased expression of efflux. That is, the pore channels needs to have an influx and an outflux, right? So if the efflux, that is once the drug goes in, but the ion balance is very bad such that it pushes the drug out. So increased expression of efflux pump is there, then a drug goes outside, it is not able to act on the bacteria, or there is alteration of the portal entries. So this is just a schematic representation of the various theories which is being proposed, or the various mechanisms in which resistance can be developed. So for simpler understanding, you can just visualize you have a bacteria site. So this is your bacteria, and it has got different channels in which it is going to take the nutrients. And one specific channel will be specific for a particular drug or a medicine. So when that drug site is altered, the medicine is not able to enter and kill the bacteria. So what are all the different ways? Either the medicine entry site is blocked, or after entering inside, it can get degraded, or once it is getting inside, the same way it can go outside as well, because of the increase in the efflux pump expressions, or it can be because the binding side, it has entered inside, the way in the target in which the binding side it has to go and attach is altered. So these are all the different mechanisms in which you can visualize the way in which the drug resistance can develop. So this is just a schematic representation as to say that what are the different families in which have been told as drug resistance, and one common family which we call as super bugs known as the MRSA. So methylene resistant streptococcus is one common organism which has developed a superpower resistance to the penicillin family. So we have to look for alternative second and third generation cephalosporins for us to destroy that streptococcus. So this is one thing which has been seen in dental era. Apart from that, these are all the different families which has developed resistance to these particular drugs per se. So what actually happens? Now we have seen that how the drug travels, how the resistance is developing. But there must be something or some kind of stimuli for the drug site to get altered, right? It cannot happen de novo. It cannot happen just like that. So what actually happens here is the transmission part, or we call this as the transfer. That is the bacteria which is actually getting resistant. How does it get that power resistance? Is because of these following methods. It can be conjugation, transduction, or transformation. Transduction is there is some kind of a foreign particle which actually helps the bacteria to develop that resistance, or there is a particular plasmid or protein which is being present in the bacteria which is getting transformed to a higher family which is called as transformation. And conjugation is because there is a combination of the other particle which is being present apart from the bacteria which actually helps in developing this resistance. So because there is a transmission of this resistance gene by the bacteria in any of these following methods, conjugation, transduction, transformation, or transposition leads to the concept of resistance. How resistance happens is what we see. Why does this resistance happen? The bacteria which is being present over there cannot just like that develop the resistance. So it needs to have something which will help in creating resistance for it. So in such cases, these are all the methods which are being used. So how do I know whether the particular drug or the particular person who is who is taking up a medication has developed resistance? The usual method is always you will just prescribe the first line of drugs to them, and there is no change or there is no improvement in the clinical condition in 2-3 days. Then only you will go for a testing whether there is the action is taking place or not. But in actual, that is now it should not happen, because this is one reason why the resistance actually develops. Because in whenever a person is actually prescribing drugs, there is more chances that he will develop resistance if the antibiotic protocol is not followed properly. So I need to first check whenever I'm going to prescribe an antibiotics. It is a golden rule that first I need to check whether he's allergic to any of the antibiotics I'm going to prescribe, or is he resistant to any of the antibiotics which I'm going to prescribe. So how do I check that? There are different methods which is being used. The first one is the Kirby-Bower method. So this is a very simple method which uses the method of culture, where 6 plates will be placed with the particular bacteria which we are going to check resistance, and the drug which is going to be supplied to the bacteria will be filled in that culture plate, and this will be the final image. So if there is a zone of inhibition, it means to say it is not resistant, whereas there is no zone of inhibition, it means to say that this bacteria is resistant to the particular drug which is being given. So this is one method. And the next method is a stroke method, which is similar to that of Kirby-Bower. But here we use something called as a test bacteria and control bacteria. So my test will be the bacteria which I want to check which is resistant or not. And the control bacteria will be something which is similar to it. And the most common controls they use is Streptococcus pyogenes and E. coli. So these are all the two. This is the most common bacteria which is used for control. And again, similarly, I'll place a drug and you look for the zone of inhibition in both the areas. Which one has the higher end tends to be the one which is not resistant. And the next one is the E test, or it's a F cephalometer test. Here I use the concept of MIC or MBC. So MIC is minimal inhibitory concentration, in which the drug is supposed to create the death of a bacteria, and MBC is the minimal bacterial concentration which is supposed to happen when a drug is given to the particular person. So here I will use the concept of MBC, how far it is able to inhibit, what is the minimum inhibition that this drug is going to create for the particular bacteria. So if that is 0, it means to say that it is not creating any zone of inhibition, then it means to say that it is resistant. So here, as you can see, there will be a symmetrical elliptical shape. If this is formed, and if this region is going to be more, it means to say that this is not resistant, and that particular drug actually has an action on the bacteria. So this is one test, and the most commonly used test is the tube dilution, where we will dilute the concentration of the bacterial present as well as dilute the concentration of the drug which is going to get delivered. So at one particular point, we will be able to know the MIC, that is what is the minimum drug level I would require to destroy this bacteria. And at one point, I will also be able to know the MBC, the minimal bacterial level, which actually gets destroyed when I add a particular concentration of this particular drug. So these are all the different methods which you will be using. Apart from that, you have a lot of immunoassays like sorbent assays, bioassays, ELISA tests to prove whether the particular bacteria is resistant or not. So this, like I said, this concept is very important because as a practitioner, even if you're going to be a medical, MDS NEET aspirant or not, as a practitioner, you need to know this concept, because we have actually created a very big global threat of antibacterial resistance, and development of new drugs is not a solution to it, rather correcting our own mistakes. So how do we correct it? Unnecessary prescription of drugs should be avoided, and always go for a broad spectrum rather than a narrow spectrum. And specifically, if there is a condition of anaerobic or septic cases, please do a culture test to identify what is that particular bacteria, and then go for the line of drug instead of doing a broad spectrum. And also you should see to it that the course of the drug is complete. Rather, after 2 days the symptoms have gone, please don't stop. Ask the patient to stop the drug. They have to complete a course of 3 days or 5 days based on the dosages which is being given. And don't ever go for any suboptimal dosages, because they are not going to have any action except a placebo reaction. So always go for the optimal dosages with the optimal dose. Even if you feel the clinical condition is very mild, then probably you can wait for a day or two with the minimal treatment, symptomatic treatments, rather than going for antibacterial or antimicrobial treatment. But if you are into an antimicrobial treatment, you see to it that you're not giving any suboptimal or sub-threshold levels, because these are all the ones which helps in developing the resistance for the bacteria. And how does it develop resistance is what we saw like transduction, transposition, conjunction, and all these methods. And how does it happen is the 5 mechanism which was depicted in the picture. So whenever a drug resistant topic is asked, these are all the basic points which you need to know. That is what actually happens here, and what are all the different tests which is being used. And as a clinical practitioner, it is high time you know what you need to do before you even touch your pen and prescription for writing an antibiotic. Okay, so now let us go to the question discussion. So the first one is, each of the following is a mechanism for drug resistant transfer between the microorganism X. This is a very straight question. So as you can see, transposons, R plasmids, conjugation. So these are all the 2 proteins which will help in transfer of the particular resistant gene in a bacteria. So this is the key over here is except. So except one, the others are all the mechanisms. So like I said, mutation. Mutation is never a drug resistant mechanism. Remember, you may think that when a bacteria gets mutated, that gene is responsible for resistance. That will never happen, because a mutation happens because a bacteria is not able to survive a particular environment. So when that happens, it is completely transformed into a different or higher grade organism. In that, there is nothing involved in drug resistance. So mutation is completely different. It is most commonly seen in virulence and expression of a clinical features of a disease, and never for a drug resistance. And the next question is, widespread and prolonged use of antibiotic leads to an emergence of drug-resistant strain. Because why? It allows the resistant strains to propagate preferentially. So what happens when there is a prolonged usage of a particular antibiotic? Because of the conjunction or transposition, it develops a resistance. And after I continue to use the same antibiotic without even knowing that I'm being resistant, it creates an environment in such a way that the resistant gene is having more chance of developing rather than a non-resistant bacteria. So the widespread use is because it is giving the preferential environment for the resistance to develop. And the next question, the following organism is notorious, that is, which is not, it's difficult for developing antibacterial resistance rapidly. Which one you think will be the answer? As you can see, all the microbes which I've given over here, pyogens, meningococcus, treponema, all these things will cause an infection, whereas Escherichia coli will cause an infection that is similar to dysentery, which has a very minimal clinical effect. So the answer will be E. coli, and E. coli developing resistance is very, very less common. So the next one, which we talked about, MRSA, the methicillin resistant staphylococci does not respond to beta-lactam antibiotics. Why? Why is it called as a superbug, or the one which has developed a super resistant? Is because they've acquired, the penicillin has got a protein structure, a binding structure, which will go and attaches itself to the bacteria, leading to the destruction of the bacteria. So they have acquired a penicillin binding protein, just low affinity for this beta-actam. So the MRSA or the superbugs has got a penicillin protein structure, which will not allow this beta-lactam to bind. So when the beta-lactam structure is not able to bind on the penicillin binding site of the MRSA, it is not able to inhibit it. That's why it is getting resistant. And penicillin being a very broad spectrum antibiotic, which is used for any kind of infection, it is called as a superbug, because looking for an alternative for a broad spectrum is very, very difficult. So the next one is, the following strategy will promote rather than curb the emergence of antibiotic resistance. So what does this question mean? So which the following you think is going to actually increase the resistance of antibiotics. It's going to contribute to my antibiotic resistance is usage of broad spectrum. Like I said, if we're going to use a narrow spectrum antibiotic, then it is going to just target a particular organism. Whereas a broad spectrum, it is going to like cover a whole area, which again is going to be difficult because the process of gene transfer will be more when a broad spectrum when compared to a narrow spectrum. So with this, we'll be wrapping up today's session. And it was just a very, very brief brush up of drug antibiotic resistance. There are a lot of questions. So definitely you will get 1 or 2 questions from here. And the past NEET exam papers, if you can see, most commonly asked questions will be the mechanisms in which how the antibiotic resistance is developed. That is the transduction, transposition, the ones we saw in the first. And also, this MRSA is also one it has been asked twice in NEET MDS exams. So if you have any questions, you can ask. If not, we can wrap up this session. Thank you everyone for spending your evening here, and thank you for the opportunity. Any doubts? I know this is a very fast class where we have to literally brush up the things, but this drug resistance is something which we have been dealing from a second year in pharmacology. So the main concept from drug resistance is that you need to understand how this antibacterial resistance is important and what are the things you need to do before you actually stop developing this antibiotic resistance. So that was the main target for this class, and I think it's been achieved. And the few questions which we discussed are really important, which you can even look back into your textbooks for further understanding. So any doubts, please free to ask us. And so if not, we can wrap up for today's meeting. Thank you.